Fear was the hallmark. Fear was at the back of our mind. Sometimes people call me in the community, you have more than 15 dead bodies at one. People dying in every home. You and a colleague work together today, and 2 days, 3 days later, he's dead. You are afraid, all right? But the patients were still being brought to redemption, to the hospital. We didn't know about Ebola, so we were not prepared to fight Ebola. We had nurses, physician assistants, nurse aides, medical doctors dying from Ebola. A lot of them. So it was quite terrifying. So everyone got afraid and ran away. But I was still available. So I thought that the best thing I could do was to contribute my quota to my country. In contact tracing, let me utilize this for the population instead of sitting and being afraid. I could go home and sit to my house because my family didn't want me to go out. I said, no, I'm a health worker, I have to go out. So someone has to take the lead. Tracing contacts was a very challenging task. We were resisted, we were targeted, all right? Because people felt that it was not Ebola, and we were trying to make up a story that the relative had Ebola. The signs and symptoms of Ebola resembles that of malaria, but they were still in a state of denial. What helped us was later on the thermoscan was introduced. Before then, someone could be having fever, you ask them, they say, oh no, I'm okay. But you can see clinically that this person is not okay. Non-body contact, infrared thermometer. When the person has fever, then we begin to tell them, look, you are not well. So the best thing you do, the earlier you go to the ETU, the better it is for you. The decision to be the first to take the Ebola steady vaccine was made when I started thinking back on the number of family members, the number of friends, the number of health workers that died from Ebola. So I knew that I was also exposed to Ebola because I was in contact tracing. So I decided, even though this is a study, I need to take part in this study. I am so grateful because since I took the vaccine, I've been feeling very well.